Have you ever noticed unusual skin lesions? In the next few seconds, you'll learn all about Mpox, also known as monkeypox. This viral disease is like smallpox but less severe. It spreads through contact with infected animals or humans. Key symptoms include fever, headache, muscle aches, and a distinctive rash. The rash evolves from flat red spots to fluid-filled blisters. Most people recover within weeks without treatment. However, vulnerable populations like children may experience severe complications. A smallpox vaccine can offer protection. Good hygiene and safe interactions can reduce risk. Governments monitor outbreaks to control spread. Stay informed and consult healthcare professionals if in doubt. Hit the like button if you found this useful.
If your patient has a rash, lesions, or fever, it might be Mpox. Don't panic, we've got you covered. Mpox, also known as monkeypox, can be tricky to spot. Symptoms include fever, headache, muscle aches, and a rash that looks like pimples or blisters. It can spread through close contact, so be vigilant. Prevention is key. Wash your hands regularly, use personal protective equipment, and avoid contact with infected individuals. Vaccination is available for high-risk groups. Treatment focuses on relieving symptoms. This includes pain relievers, fluids, and rest. In severe cases, antiviral medications might be necessary. Stay informed and be proactive. By knowing the symptoms, practicing prevention, and treating early, you can manage Mpox effectively. Your patients are counting on you. Thanks for watching.
Welcome to today's session on Mpox. In this video, we will cover all aspects of Mpox, including its causes, symptoms, diagnosis, treatment options, and preventive measures. We'll also include some USMLE-style questions to test your understanding. USMLE-style questions. Question 1. A 25-year-old man presents to the clinic with a fever, malaise, and a rash that began on his face and has spread to other parts of his body. The rash started as macules and has progressed to vesicles and pustules. He reports having unprotected sexual contact with multiple partners in the past month. What is the most likely diagnosis? Answer: Mpox, formerly known as monkeypox. Explanation: the patient's symptoms, including fever, malaise, and a characteristic rash that progresses from macules to pustules, along with a history of unprotected sexual contact, are consistent with Mpox. Question 2. A 32-year-old woman presents with fever, lymphadenopathy, and a vesicular pustular rash on her hands and face. She recently traveled to a region where there is an ongoing Mpox outbreak. Which diagnostic test would confirm the diagnosis? Answer: polymerase chain reaction, PCR, testing of a lesion sample. Explanation: PCR testing of a lesion is the gold standard for diagnosing Mpox, as it detects the DNA of the Mpox virus. Question 3. Which of the following is a common complication associated with Mpox? A. Severe dehydration. B. Pneumonia. C. Diabetes. D. Rheumatoid arthritis. Answer: B. Pneumonia. Explanation: pneumonia is a known complication of Mpox, especially in cases involving severe respiratory symptoms. Question 4. A 28-year-old man diagnosed with Mpox is seeking advice on preventing transmission to others. What is the most effective preventive measure he should take? Answer: avoid close contact with others and practice isolation until the lesions have healed completely. Explanation: isolation and avoiding close contact are critical to preventing the spread of the Mpox virus. Question 5. A healthcare worker who was exposed to a confirmed case of Mpox is advised to get vaccinated. Which vaccine is recommended for post-exposure prophylaxis against Mpox? Answer: Jynneos vaccine, also known as modified vaccinia ankara or MVABN. Explanation: the Jynneos vaccine is recommended for post-exposure prophylaxis against Mpox and is particularly useful for healthcare workers and individuals at high risk. Now, let's dive into the specifics of Mpox. Mpox, overview. Mpox, formerly known as monkeypox, is a zoonotic viral disease caused by the Mpox virus, which belongs to the Orthopoxvirus genus. It is similar to smallpox but typically less severe. Mpox primarily affects humans and some animal species, including primates and rodents. Causes: virus, Mpox virus, Orthopoxvirus genus. Transmission: animal to human, through direct contact with blood, body fluids, or cutaneous or mucosal lesions of infected animals, e.g., monkeys, rats, squirrels. Human to human, through respiratory droplets, direct contact with infected body fluids or lesion materials, and indirect contact through contaminated materials such as bedding or clothing. Sexual contact: recent outbreaks have indicated transmission through close physical contact, including sexual contact. Symptoms: incubation period, typically 6 to 13 days, but can range from 5 to 21 days. Prodromal symptoms: fever, malaise, headache, muscle aches, swollen lymph nodes, lymphadenopathy, which helps distinguish Mpox from other similar diseases like smallpox. Rash. The rash typically starts within 1 to 3 days after the onset of fever. Begins as macules, progresses to papules, vesicles, pustules, and then scabs. Rash often starts on the face and then spreads to other parts of the body, including palms and soles. Lesions are typically firm or rubbery, well circumscribed, and may be umbilicated. Other symptoms: sore throat, cough, shortness of breath. Signs: lymphadenopathy, enlarged lymph nodes, especially in the neck, axilla, and groin. Lesions: various stages of rash can be seen simultaneously. The lesions are deep-seated and may leave scars upon healing. Investigations: polymerase chain reaction, PCR, the preferred method for diagnosing Mpox. Samples are taken from the vesicular fluid, lesion roof, or crusts. Virus isolation: although definitive, it is less commonly used due to the need for high containment laboratories. Serology detects antibodies, but cross-reactivity with other orthopoxviruses may occur. Treatment. Treatment objectives: alleviate symptoms, prevent complications, minimize spread to others. Non-pharmacological treatment. Isolation: patients should be isolated to prevent the spread of infection. Supportive care includes maintaining hydration, adequate nutrition, and managing secondary bacterial infections if they occur. Wound care: keep lesions clean and dry to prevent secondary bacterial infection. Pharmacological treatment. Antivirals. Tecovirimat, an antiviral specifically approved for smallpox and used under investigational protocols for Mpox. It inhibits the virus's ability to spread within the body. Cidofovir, used off-label for severe cases, especially in immunocompromised patients. Brincidofovir, another antiviral option being explored. Pain and symptom relief. Paracetamol, acetaminophen for fever and mild pain. Ibuprofen, for pain and inflammation. Prevention. Vaccination. Jynneos, modified Vaccinia ankara, MVA, is safer, non-replicating vaccine approved for preventing Mpox and smallpox. Recommended for high-risk groups and healthcare workers. ACAM2000, a live, replicating smallpox vaccine that may be used for Mpox but carries more risks. Avoid contact with infected animals, especially in areas where Mpox is endemic. Practice good hygiene, frequent hand washing and using alcohol-based sanitizers. Personal protective equipment, PPE. Use PPE when caring for infected individuals. Referral criteria. Severe cases, especially those involving complications like pneumonia or encephalitis. Immunocompromised patients at higher risk of severe disease. Cases requiring specialized care and antiviral therapy. This comprehensive overview of Mpox covers its causes, symptoms, diagnostic methods, treatment options, and preventive measures. Remember, early detection and isolation are key in managing Mpox and preventing its spread. Stay informed, and practice preventive measures to keep yourself and others safe.